Hi everyone. The human body is a wonderfully designed organism which can give you certain signs and symptoms of the damage that is happening inside you. This is Dr. Pawan Saagar. I am a homeopathic physician. In today's video, I will be explaining about 10 such warning signs of your liver damage. The liver is a unique organ which does multiple functions in our body for us to stay healthy and alive. A damaged liver will always show different signs and symptoms where it is asking for your help. Now, by paying attention to these various signs and symptoms, we will be able to control the liver damage and even reverse it. But if you are going to ignore these signs and symptoms that your liver is showing you, you may end up in permanent liver damage, or in worst cases, it can also lead to death. So let us start understanding what are these signs and symptoms that the liver is constantly showing us when it is damaged. If you are experiencing tiredness and weakness from a long period of time, it could be because your liver is damaged. When a liver is damaged, it does not work as efficiently, due to which there is buildup of toxins in our blood. Now, because of this increasing amount of toxins in the blood, we will start feeling tired or weak. And the good news is this is one of the earliest signs of liver damage. So at this stage, if you can go to a doctor, get this diagnosed right and start treatment, the progression of your liver damage will start getting reversed, and a healthy liver will always give you a healthy life. So that is why if you are feeling tired or weak from a very long period of time, do not ignore this. This could be something very important. So go and get yourself checked, go and get yourself treated. Nausea and vomiting are one of the earliest signs of liver damage. This happens because of the buildup of toxins in our blood, as the liver is not functioning efficiently. The other reason why you might have nausea or you might be vomiting is because of impaired bile production. Now, bile juice is essential for the digestion, and when a liver is damaged, it is not able to produce the bile juice as efficiently, because of which you might experience nausea and vomiting. So that is why getting these treated as early as possible is best for your health. Many people experience loss of hunger along with loss of weight, but in some people it could be an excessive hunger, and this leads to obesity, gaining weight. The problem is, in both of these conditions, the liver has been damaged. That is because when there is liver damage, like I already mentioned, there is toxin buildup in your blood. Now, because of this, some people experience symptoms like bloating, not feeling hungry, and also constipation. All this is because of impaired bile production. We need bile juice for complete digestion, meaning for the fat to be digested in the food that we eat, we need bile juice. And when there is a lack of bile juice, there is loss of hunger. This leads to loss of weight over a long period of time. Now, coming to the point where some people feel an excess of hunger and this leads to gaining weight. Because liver is directly related to metabolism, there is something called as leptin resistance that gets developed in people who suffer from liver damage. Now, because of this leptin resistance, they do not feel full very quickly, and they also feel like eating again and again. This leads to gaining weight. So both of these are a sign of your liver being damaged, and these need to be given importance, and you need to get them corrected. Otherwise, both of them can be very harmful for your health. Many people also experience an abdominal pain and an abdominal discomfort. Now, this is peculiarly on the upper right side of our abdomen. This is a sign that your liver is damaged, because a pain on the upper right side of the liver, where the liver is present, is common in people who have liver inflammation. Now, this is very common in people who consume alcohol. This is called as alcoholic hepatitis. So This condition can give you pain in the upper right side of your abdomen, and if this gets serious, it will also go into something called as ascites. Now, ascites is building up of fluid in your abdominal cavity, making your abdomen tense and hard. For this condition, you'll have to go to a hospital for the fluid to be drained, and if you are not taking these signs of your liver seriously, ascites can keep occurring and it can lead to a permanent liver damage. Due to impaired liver function, the protein metabolism gets affected. Now, because of this protein metabolism being affected, what happens is there is an imbalance in the hormones that regulate the fluids in our body and the protein, because of which there is filling up of fluid in our ankles, legs, and also abdominal cavity, which is called as ascites. This is again a sign that your liver is telling you that there is some damage in your liver. Now, if this is not treated and if this is not taken seriously, then, like I already mentioned, there can be serious consequences where there is irreversible damage done to your liver, and this can be very serious. Having itchy skin from a long period of time is also a sign that your liver is not functioning well. That is because it could be a reason of deficiency in certain vitamins like vitamin A, vitamin D, vitamin E, and vitamin K, which are essentially stored in your liver. Or it could also be because of excessive bile salt accumulation in your body. So what happens is that when the bile is produced by the liver, it has to go and reach your intestines for the digestion of the food. Now, for whatever reason, if the bile is not able to go into the intestines, what happens is that it starts getting into your bloodstream. Now, when this starts going into the blood, it will create itchy skin. So this itchy skin is again a sign that your liver is not functioning well, or there is something wrong in your liver, which is leading to a persistent itchy skin, an itchy skin from a very long time. You may all have heard the term jaundice, and many of you might have even seen people who are suffering from jaundice. And it is easy to recognize someone who is suffering from jaundice because of the yellowish discoloration of the skin, the nails, and even the white part of your eye called as the sclera. But do you know what happens in jaundice and how liver is involved? That's because we have something called as bilirubin, which is a waste product that is generated when the red blood cells die in our body. So this bilirubin is not water soluble. So it reaches the liver. So in liver, what happens is that it gets mixed with something called as glucuronic acid. Once it is mixed with glucuronic acid, it becomes water soluble, and now it is called as conjugated bilirubin. So in a person who is healthy, this conjugated bilirubin should go to the intestines from the liver. But if your liver is having some sort of damage, what happens is the bilirubin is not able to leave the liver completely, so it stays in your liver. Now what happens is that it starts getting mixed with the blood that is present in your liver, and it starts circulating in the body. This is what gives that distinct yellowish discoloration of the skin, the nails, and even the white part of the eye. So that is why we see people who are suffering from jaundice with yellowish discoloration, and this is how a liver which is damaged leads to this condition called as jaundice. As we all know, in a normal person, the color of the urine is pale yellow and the stools are yellowish brown. But if you are suffering from liver damage, this can get reversed completely. So your urine will start looking very dark and your stools will become pale in color. That is again because of this bilirubin and impaired liver function. So like I mentioned already, what happens is that bilirubin is not able to leave your liver and go into the intestine. So what usually happens is bilirubin would get mixed in your intestines with whatever you have eaten, and it will give the color to your stools. So with the water, whatever gets absorbed into your body, bilirubin will leave your body through urine, and that is why the pale yellow. So this is in a normal person. But if you are suffering from liver damage, what happens is that bilirubin will start getting mixed in your blood, which is present in the liver. This blood will go to the kidney for getting filtered. Bilirubin will then get filtered through the kidneys and it will give that distinct dark color to your urine, and this is what will cause dark urine and tail stools, which are a very big sign of liver damage. So if you are seeing dark urine and tail stools, then it means your liver is severely damaged and you need to go see a doctor before it's too late. When there is an injury to our body, we will have bleeding. So this bleeding will be stopped by a mechanism in our body by forming a clot. Now this clot formation has to happen between 8 to 15 minutes in a healthy person. But if you are suffering from liver damage, what happens is that this clotting time will be prolonged, which leads to a prolonged bleeding time. So this is a very important sign of liver damage, because like I already mentioned, liver is responsible for the protein metabolism. So what liver also does is producing certain proteins that are required for the blood to clot in the site of an injury. But if your liver is damaged, it is not able to produce these essential proteins that are required to clot your blood. That is why if a doctor suspects you having some sort of liver damage, then we suggest you to get a blood test for your bleeding time, clotting time, and also something called as prothrombin time. So these are something very crucial in order to determine your liver damage. Because of liver damage, what happens is that there is an excessive amount of ammonia building up in your blood, which makes your blood toxic. Because of this, we see a condition called as hepatic encephalopathy. In hepatic encephalopathy, what happens is that this toxic blood affects the brain, which leads to an inflammation of the brain. Now, because of this inflammation of the brain, there is an imbalance in the neurotransmitter. I've made a video on what are neurotransmitters. I'll give the link for that and you'll be able to watch that and understand what are neurotransmitters. Now, because of this imbalance in the neurotransmitters, we see people experiencing confusion, loss of memory, impaired perception, and even difficulty in concentration. So these are all the signs and symptoms of extensive liver damage. In people who suffer from cirrhosis, these are the kind of symptoms that we see because of the damage of liver. So these should be taken seriously and you need to see a doctor and get the patient treated as soon as possible. Being a homeopathic physician, I come across many people who suffer from various liver diseases. And through homeopathy, I'm able to treat them and I'm able to see great results treating people from homeopathic medicines. But one thing that I tell people who suffer from liver diseases, especially those which are related to lifestyle like alcoholic liver disease or even non-alcoholic fatty liver disease, is that your liver problem did not come to you overnight and it has been developing in you from the past decade or even more than that. So what I tell people is that having the right lifestyle, that is eating the right food, being physically active, and if you are consuming alcohol, stop consuming alcohol or at least keep your alcohol consumption under control. By doing these simple things, you can preserve your liver health, and 10 years or 15 years down the line, you will not end up in some sort of liver problem. That is why I continuously keep telling everybody that liver should be given a lot of importance, and liver is a very important organ in our body. If you felt this video was helpful and you enjoyed watching this video, do share this with your friends and your family, and you can comment and tell me how you felt about this video. I'll see you in the next video. Thank you for watching. Bye.